Thanks for joining me, and welcome to my channel, Practically Social, for therapy, self-help, and social issue-related topics. Purpose here at Practically Social is to help you live your best life. My name is Zachary. I'm a clinically licensed social worker and therapist. Today's video is set to cover two topics: why I started the channel, and to give tips for beginners in therapy. Please like, subscribe, and leave comments. During our time, we'll be covering three questions beginners in therapy frequently ask. What is therapy? What will I do in therapy, and what will I get out of it? Before we get to that, please allow me to share the inspiration for Practically Social, which came from my clients, family, and friends. My background in mental health, addictions, children's services, and criminal justice fields began in 2009. I started out at a private counseling center where I ran substance use groups. After that, I did community-based skills development for one of the largest mental health providers in the state, largely working with people with bipolar and schizophrenia disorders. Then I went back to school and got my master's degree in social work so I could become a therapist. In the early days of the pandemic, I was working at an outpatient mental health clinic. I'd gone through a divorce and was struggling to enhance stronger social support for myself. I was dating, but not with much success. Somebody mentioned to me that as a therapist, I could probably do a dating blog, and that I'd likely have a lot of good advice about being conversational and avoiding pitfalls, but mainly how to avoid most of the mistakes I was making. Others asked for help on how to overcome introversion, as I'm mostly extroverted. Some of my colleagues asked me to share my unique perspective on mental health, self-help, and social issues. Clients often said it would be helpful if there were more YouTube videos by qualified professionals that talk about some of the tougher issues they face. As a longtime educator, I accepted the challenge. I've started this channel with the intent of helping people develop solutions for mental health challenges, reducing isolation, increasing understanding of society and ourselves, and yes, even offering dating advice. All of this amidst the vast social changes as a result of a global pandemic. Additionally, as therapy isn't always an option for everyone, Practically Social is one of my contributions to the wider range of freely available information. So thank you for joining me. First and foremost, I'd like to make it clear that although I'm a therapist and my practice informs the work I do here, Practically Social isn't a substitute for professional help. I do hope you find the content at a bare minimum informative and most of all useful. I also think at times you'll be entertained, which makes me happy too. We'll cover a vast array of topics where we'll share thoughts on therapy methods, self-help tools, and social issues. In the future, I'd love to have some special guests. On that note, please take what I say with an open mind, as I'm human. I don't know everything, nor will I pretend to. We may not always agree, though I may be convinced by a good argument. We may not find the same things funny, though I do use a lot of humor and value a good sense of humor highly. That said, I welcome your dialogue. Encourage everyone to do their own research. Discover what works best for you. If what you find here or elsewhere is helpful, please share it with us here in the YouTube universe. Thanks for sticking with us. How do you feel so far? Okay, let's dive into therapy tips for beginners. If you're new to therapy or you're considering getting started, you're in the right place. I spend a lot of time educating about mental health and substance use, especially for people who are new to treatment. So I hope after this video, you'll feel more at ease with the possibilities therapy has to offer. The first questions I'm often asked are, what is therapy? What will I do in therapy? And what will I get out of therapy? So we'll break it down by these three questions and their answers. First, we'll start with, what is therapy? Therapy is a process that can help you to cope with mental health struggles. Seeking therapy doesn't mean you're crazy, or that you're weak because you sought help. Therapy is a place where many people resolve deeper issues that trouble them. Never feel shame for saying you need help, and take pride in your courage to ask. The first step is the hardest, and you only have to do that first session one time. So give it a try. For most people, in the beginning, therapy can be a little anxiety-provoking, which is normal. You may fear what you don't know yet about therapy or your therapist and what you'll do. You may meet your therapist in an office or online. Rest assured that your therapist is a licensed professional. though in some instances you may meet with a student therapist who's overseen by a licensed professional. Your therapist is concerned with treating mental health and or substance use disorders through psychotherapy, talking about problems, as opposed to doctors and prescribers who use medical care involving your physical health and medications. Therapists can work closely with these types of providers in order to best serve you, though their objective in meeting with you is to listen and help you through tough issues. Many good therapists have a holistic approach to wellness and can offer you great resources or refer you for other needs. Though each therapist has their own approach, therapy involves talking, typically about personal problems that are psychological in nature, like anxiety, depression, or other mental health or substance issues. Topics typically include your personal life, relationships, stress, trauma, grief, or life goals. You might find yourself shocked that a stranger would ask you questions related to these topics, or you may be beyond ready to begin talking about long-standing problems. Therapy is a safe and great place to begin. Some therapists will have you do exercises, worksheets, or journals that might resemble homework, and this homework is quite different than what you would get in traditional schoolwork for two reasons. One is because it helps you work through your concerns, and two is it's not graded. Most of all, this homework will give you tools to use in the future. Over time, you should feel more comfortable talking about deeper things in your life with your therapist. A professional therapist isn't there to judge you personally, though part of their job is to use their clinical judgment to get you the right care and help you reach your goals. Having a good therapist means being able to talk confidentially about things that are most important to you in a safe place with someone you trust. So what will you do in therapy? First part of therapy is to choose a therapist that's right for you. Even if a therapist has been assigned to you or you selected a certain company to provide therapy, you still have choices in mental health care. This means you're not obligated with any particular individual or health provider. Choosing a therapist comes down to one thing: feel comfortable. Though we discussed how therapy will be awkward for a few sessions, overall you should feel comfortable with your therapist going forward. Questions you can ask yourself to determine this comfort level include: are they listening? Are they non-judgmental? Are they supportive? Do they seem objective and open-minded? Do they respect my decisions and encourage my empowerment? Lastly, if they provide a diagnosis, do they discuss it with you and answer your questions? Can they explain why they use various approaches? If for some reason you don't feel comfortable with your therapist, discuss it with them and be honest. They can handle it. If you don't feel comfortable talking to your therapist individually, speak with their supervisor and be sure to tell them specific reasons why you'd rather work with someone else. More specifically, what qualities you're seeking in a therapist. You may prefer a different counselor for various reasons, so if you want to switch, let them know. This can help ensure you feel comfortable working with the next therapist. Some therapists specialize in areas of interest such as trauma, LGBTQ, addictions, or various therapy methods. If you have a specific type of therapist in mind, be sure to mention this during your introductory questionnaire. These tips should help give you the best possible experience from the beginning. One theory suggests that the client-therapist relationship bond is the best predictor of success. Personally and professionally, I want you to have the best fit for the best results. So you've selected a therapist. What's the first session going to be like? A good therapist will usually begin your session by talking about confidentiality and risk. Therapists hold everything you say confidentially with a few exceptions, which are if you're a danger to yourself, someone else, or a child. They may ask you awkward questions such as if you currently or have in the past felt suicidal. These questions are for your safety. Trust that your therapist has your best interest at heart. They'll likely ask you quite a bit about yourself, what brought you to therapy, and next, what's your goal for therapy? What issues or concerns do you think are most important? How do you want this to guide your sessions and therapy work? Once you have a goal for therapy, you're well on your way to finishing your first session. To summarize, you'll begin therapy working with a therapist that's right for you, and they'll likely begin the first session with introductions, asking what brought you to therapy, more personal details related to your past, and lastly, what you'd like to get out of therapy, which we call a therapy goal. Therapy goals are a great way to set up what you might get out of therapy, which we'll cover shortly. Before that, I think it's also important to discuss a common misconception about therapy, the myth of hospitalization. A lot of people told me they were afraid to seek help because they thought they were going to therapy, which would lead to mental health hospitals or institutions. This couldn't be further from the truth. Mental health care has come a long way from the asylums of history, myth, and nightmare. Since the 1980s, the trend toward institutionalization has sharply decreased. Insurance companies, doctors, and therapists, wherever possible, universally prefer to treat patients and clients in the community to avoid hospitalization or residential care. Sometimes a client requires that higher level of care, though very infrequently, giving the larger number of clients seeking mental health care. Long-term inpatient care is both expensive and, unless necessary, not preferred. It's cheaper for insurers to reimburse community-based care, such as outpatient mental health providers like therapists. And it benefits both insurers and consumers by reduced costs, fewer hospitalizations, and a lower chance of long-term hospitalization. Plus, people generally heal better in their natural environment where they feel more comfortable. Let's dispel the myth that if you go to a therapist, they'll try to commit you or get you hospitalized. The exceptions are those who are a danger to themselves or others and genuinely need stabilization to return to their functioning. In the hospital, they're treated, stabilized, and generally released in a short amount of time. If it can be avoided, no caring professional wants someone to go to the hospital, unless it's necessary, guided by good clinical judgment and preferably short term. Mental health and substance treatment professionals would rather see you in your community living your best possible life. The images portrayed in the movies and TV of men in white coats and straitjackets are just that, fictional. Most likely, you'll go to your first therapy appointment and walk away feeling better, with another session already set up. Finally, today we'll talk about what we get out of therapy. The most important thing you can get out of therapy is a better you. Your therapist should help you establish the goal you want to work on, whether it's reducing anxiety or depression, having better relationships, overcoming your past, or getting tools to help you recover from a variety of issues. Therapy is also a good place to establish a relationship based on trust. Many people, especially those who suffered trauma, struggle with trust, feeling heard, and motivation. Therapy is a great place to vent, be validated, establish trust in someone, and strategize for your future. You likely will discuss things with your therapist that are difficult to face. Going through the process of talking it out translates to better results in your daily life. So don't give up when therapy feels challenging. That feeling of challenge is likely just you growing. Any good therapist puts your concerns and strengths at the center of the session. They can help guide you through your problem-solving process. Your therapist should also review your goal and progress with you periodically. It's important also to keep in mind that the therapist isn't there to solve your problems for you. One of the toughest things about therapy is the work for you, the client. You'll experience a lot of emotion. You are free to express your emotions, and doing so enhances the healing process. So don't be afraid to show them. The only way out is through, with you leading the way. Your therapist is your trusted guide to lean on when you're confused, scared, angry, or hurt. Ultimately, ownership of the process and outcome is up to you. The work you do will have results. Are you ready? Now, a word about asking your therapist, what should I do? If you ask your therapist for advice or feedback, be open-minded and know that not all advice or feedback may be helpful. Yet your therapist will offer it with the best intention. Some therapists prefer to use the experience of others to help you, and sometimes, if they think it might help, They may offer their own experience. Just keep in mind they're human too, and their primary goal is to help you with a variety of tools. If you have a disagreement about their advice or feedback, feel free to voice it. Building a solid, honest relationship with your therapist can provide excellent results. Though a therapist can't be your friend or have a relationship with you outside of therapy, they can be a tremendous aid in self-improvement. If you don't find therapy helpful, discuss it with your therapist and they can walk you through options. You may also get to a better place and wish to stop therapy, which is an awesome personal goal. You can always return if you need to. Lastly, remember that there are other avenues besides therapy if you're seeking help. Books, support communities, podcasts, and even YouTube channels like Practically Social are here to assist and promote your well-being. I look forward to hearing from you and learning about your successes. So that's it for this episode of Practically Social. Please like, subscribe, and share for weekly episodes related to therapy, self-help, and social issues. If you have a topic you'd like to see covered, please leave a comment below. Till next time, I'll be listening.